Vaccine hesitancy is still an issue in the midst of this pandemic. Some people are trying to change that. I have here with me Dr. Lisa Fitzpatrick, who, among being a medical doctor and an epidemiologist, she also serves as co-chair on President Joe Biden's healthcare policy in Washington. Thank you so much for being here today. We appreciate you coming out.
Thanks for having me, Shelby.
So we were just talking a little bit in the commercial break, and you're actually from Washington. So why come here to areas like Pritchard and Mobile?
Well, we need to be here, Shelby, because a lot of the people who are still being affected by the pandemic and COVID-19 are right here in the South. And I think we don't pay enough attention to folks in the South. We have low vaccine uptake rates here, but we still have lots of people who are dying and getting very sick from the virus in the South. So it's important for us to be here.
And doctor, what are some of the things that you're hearing from people as you're out and about in our communities as far as vaccine hesitancy goes?
So what's fascinating, Shelby, is we've been in different cities throughout the pandemic, and the questions are always the same no matter where we are. People want to know if the vaccine is safe, what's in the vaccine, and if there are side effects. Those are the top three questions we get. In fact, one woman asked me if she takes the vaccine, could she get pregnant? And so this is also a very common concern we're hearing. We know the vaccine is safe for pregnant women. The American College of Gynecologists and Obstetricians are suggesting that pregnant women get vaccinated along with everybody else. So we want to reassure people that the vaccine is safe and it's much less risky than getting COVID-19 for most people.
Are you seeing specifically hesitancy in people of color versus white people? Is there any change or difference in that?
Well, we were invited here today by the Bay Area Women's Coalition, and they primarily serve the African American community here. So most of the people, if not all of them, were from the African American community. And at Grapevine Health, we have a mission to serve the underserved Black and brown communities in the United States. And so as part of our mission, we wanted to be here to talk specifically to the Black community.
What is the message, if you just had one thing to tell people who are still on the fence or still haven't gotten their shot, what would you want to say to them?
Getting vaccinated is not just about protecting yourself, it's about protecting your community. And the reason people need to understand this is because just because you're someone who's young and healthy, you can still spread the virus to someone else who's not as young and healthy as you are. And a lot of those folks might end up in the hospital or even worse, die from COVID-19. So we have to look out for each other, and this is the reason we need everyone to get vaccinated. And if they have questions, we want them to contact us at Grapevine Health, or they can reach out to the CDC or other places, or even the Bay Area Women's Coalition right here in Mobile, Alabama, to get their questions answered.
All right, Dr. Fitzpatrick, thank you so much for being here. Are you on your way out back to Washington, or are you here for a few days?
Well, I hear there's a tailgating event and a big homecoming game in Baton Rouge, so that's where we're going tomorrow.
Hey, that's nice. Go Tigers. All right, thank you so much for being here. We appreciate it.
Thank you.
Well, you can rewatch this interview again or share it with someone you know. Just head to our YouTube channel shortly after the newscast and be sure you click subscribe so you never miss out whenever a new video is posted.